Our healthcare system isn't broken, it is shattered.
Jackie Bain knows her mother is getting the care she needs now that she's in hospital. But twice, 92-year-old Barbara Ross's calls to 911 were downgraded to 811, the non-emergency health link number for Albertans looking for medical advice.
Her care facility called 911. And she said to me, Jackie, I don't know what's happening, but they switched me to 811, asked a bunch of questions.
This caught Jackie and her mom off guard because it happened before the province let people know about the change, where calls are now triaged and those not needing an ambulance are passed on to 811. Barbara was told twice to go to her family doctor, despite telling the operators she had some chest pains, breathing problems, dehydration, and difficulty walking.
And me saying to them and begging them, I physically can't take her. She physically can barely walk to get there. And they just sort of brush their hands at it and say, well, take her to the doctors.
Jackie says 811 told her to contact a private medical transport service.
This is not about trying to weed out people that are calling 911. This is about adding a different level of care, a better level of care.
The Associate Executive Director of EMS Dispatch says it's patients who would wait, sometimes for hours, for a paramedic to look them over that are being offered a chance to talk with a registered nurse instead, freeing up resources. While he cannot comment on specific cases, I asked about Barbara Ross's symptoms.
Standard protocol to say go to see your family doctor?
No, in those cases that you've listed, those would likely be identified as high acuity events, and an ambulance would be responded.
Saying there are internal review mechanisms to understand what happened. The opposition NDP calling for better staffing of the EMS system.
That perhaps the government is rushing or moving forward on these things a little too quickly because they are desperate to show that they are taking some form of action.
It's been a week since Jackie drove her mom to the hospital, where Barbara is still admitted, but on the mend.
When I told my story at triage, one of the nurses said, we've heard about this, but we've never actually seen someone come in that's been denied 911, and you can absolutely see that she needs it. She needs to be here.
Saying she understands the need to take steps to free up EMS, but believes there needs to be better oversight.
A country like Canada, we should not have to be fighting for care for loved ones.
City News reached out to the Health Minister's office for comment, but did not hear back by broadcast deadline. In Edmonton, Carly Robinson, City News.